Infections are one of the main causes of maternal and neonatal mortality. Infections are caused by invisible germs, which in most cases are transferred from healthcare workers' hands, either from another patient or from contaminated equipment and surfaces. These infections can be prevented. Hand hygiene. Perform hand hygiene before and after every procedure, even when hands are visibly clean. Wash your hands with soap and running water, or better, use alcohol-based hand rub. Use hand rub when hands are visibly clean, as hand rub kills more germs than hand washing. Germs can hide. Always have short fingernails and do not wear nail polish, artificial nails, rings, long sleeves, wristwatch, or bracelets. Procedure for hand washing. Wet hands with clean running water. Use liquid soap from a dispenser. If not available, use plain, dry, and visibly clean soap of small size from a rack that drains. Germs will grow in wet, dirty soap. Apply soap. Vigorously rub all areas of hands and fingers together for at least 20 seconds, especially between fingers and under fingernails. Rinse hands with clean running water. Close the tap with your elbow. Use paper towel to dry hands. If not possible, use a clean, dry towel, but make sure the towel is clean and has not been used by you or others before. A shared towel that has been used multiple times by multiple people quickly becomes contaminated and can transfer germs to your hands. Therefore, wash the towel in hot water after each use. Procedure for hand rub. Apply a palmful of hand rub to cover the entire surface of hands and fingers. Rub the solution vigorously into hands, especially between fingers and under fingernails, until your hands are dry. See procedure on how to make alcohol-based hand rub. Perform hand hygiene before and after each patient contact. After contact with patient's surroundings, before a clean procedure, after body fluid exposure risk, including after using toilet, and before wearing and after removing gloves. Personal protective equipment. At birth, wear a plastic or rubber apron to prevent body fluids on your gown or skin. Wear gloves when you're in risk of touching body fluids, and change into clean, closed footwear. Preferably, use sterile gloves. If they're not available, use clean examination gloves. Do not wear the same pair of gloves for different patients. It's important that you put on sterile gloves correctly so they do not become contaminated. Prepare a large, clean, dry area. Open the outer glove package, drop inner cover on this area, and then perform hand hygiene. Open the inner glove wrapper, exposing the cuffed gloves with the palms up. Pick up the first glove by the cuff. Touch only the inside of the cuff. While holding the cuff in one hand, slip your other hand into the glove. Pick up the second glove by sliding the fingers of the gloved hand under the cuff of the second glove. Be careful not to contaminate the gloved hand with the ungloved hand as the second glove is being put on. Adjust the glove fingers and cuffs until the gloves fit comfortably. Be careful not to touch anything non-sterile before touching the operational site. When removing gloves, do not allow the outside surface of the used gloves to touch your skin. Place all waste items in a leak-proof container with a lid and perform hand hygiene. Cleaning. Wear utility gloves and an apron to protect from any splashes. Disassemble all items. After use, all items should be cleaned immediately in a solution made of warm water and the correct concentration of detergent. If cleaning is not possible immediately, place the items in an empty basket and cover the items with a moist towel until cleaning is possible. Clean items with a toothbrush in the solution. Do not use bar soap for cleaning items. All items should be individually inspected and visibly clean. Rinse items with clean running water and air dry before sterilization or high-level disinfection. Storage. The risk of contamination is high when sterile items are in a sterilized container that is repeatedly opened and closed each time an item is removed. If an item is contaminated, it must be re-sterilized. Therefore, items should be divided into each procedure and sterilized, either double-wrapped in non-woven fabric or placed in a small covered, dry, sterile container. Keep the sterilized items in a closed cabinet. Arrange cleaning and storage so activities and objects flow in an organized way from contaminated items, cleaning, sterilization or high-level disinfection, to storage. Separate dirty and clean areas. Housekeeping. Clean high-risk area with solutions made of detergent and water. Dry off with a clean dry cloth and wipe over with 70% alcohol. Clean washable bed, table, delivery bed, walls, ceiling, floor, and toilet. Clean even if there was no berth at the delivery bed. Spread of germs can be prevented with simple hygiene procedures when you're persistent and disciplined. HIV and hepatitis B prevention. Remember that HIV and hepatitis B are common and therefore pose a risk to healthcare staff who come into contact with infectious fluids, blood, genital fluid, amniotic fluid, any blood-stained fluids. Personal protective equipment is the best way to protect against exposure. All health workers should have the hepatitis B vaccine, which is highly protective. Transmission is most likely if inoculation happens through the skin. Mucosal splashes have a much lower risk. Exposure to intact skin carries no risk. If exposure occurs, take post-exposure prophylaxis, PEP, for both HIV and hepatitis B, if not vaccinated, which should be available in all health facilities. Be sure to complete the protocol, including HIV testing and taking PEP for the entire 28 days.